Sciences at UC Irvine, and we're just going to wait a little bit as people move from the waiting room into the presentation space here. But I'm really thrilled that folks could join us this afternoon for the second of what we've been calling our Zeries, because this is all happening over Zoom. We had a trial balloon a couple of weeks ago when we had a lecture by Dr. Stephen Muldrum, who talked about the social science of public health in a pandemic. And that really was an opportunity for us to learn how we could use this platform so that we could share insights from the social and behavioral sciences about the pandemic with the wider university community and the community at large. I'm very pleased now that we've built up a full schedule of these little Zeries talks. You can see that schedule on the School of Social Sciences website at socsci.uci.edu. And they'll feature faculty from the school who have expertise and are doing research on a range of topics and from a number of different fields in our school. Our speaker today, Professor Zhan, is from the Department of Anthropology. She has expertise in traditional Chinese medicine in global markets, among other things. And later in the quarter, we'll have lectures from people from political science, cognitive sciences, logic and the philosophy of science, and other fields from our school. So again, thank you all for being here. Professor Zhan will give a presentation, and then there'll be some time for Q&A near the end. If you'd like to ask a question, at the top or bottom of your screen, there's a little Q&A icon with two little speech balloons. You can click on that and pose a question, and after the presentation, I can read some of those questions off to Professor Zhan, and she'll provide a response. So then, without further ado, welcome. Professor Zhan, you have the floor.
All right, thank you, Dean Maurer, and everybody who is in attendance. So let's see. So my name is Zhan. I, as Bill used, work on medical anthropology, science and technologies. So we're going to begin with some previous work. Actually, I did in the wake of the SARS epidemic in 2003. So if we could go to, oh, sorry, okay. And I had never imagined actually I would return to this topic ever again, because my own project right now, classical medicine, but here we are as we are still in the midst of this new pandemic. So as an anthropologist, we're interested in people's everyday life, and fieldwork today, right now, actually comes a lot out of Chinese social media, since obviously physically I will not be there. So I am going to just show you some snapshots of what people are really going through in their everyday life in China as it is reflected on Chinese social media. So I'm going to begin with the Qingming Festival of 2020. So for those of you who are not familiar with traditional Chinese holidays, the Qingming Festival or Qingming Jie usually happens on April 4th or 5th every year. So, and it's also when you sweep the tombs of your ancestors. So it's probably the most important day of the year when people pay respect to the dead. It's also a day that kind of celebrates the beginning of spring, because Qingming literally means clear up. So winter is gone, flowers start to blossom, and life comes back to earth. So this year's Qingming Festival, of course, on a very special meaning, as sort of coming gradually out of the depth of the outbreak in China, especially in the city of Wuhan. And it was really turned into a day of national mourning. So the Chinese state, of course, wanted people to commemorate those who perished during the outbreak, and especially doctors and other medical professionals who died on the front line. But at the same time, on Chinese social media, people also started their own commemorations. So there are a lot of lists that the social media users created to remember the people that they think should be memorized. So I'm going to show you, actually, Bill, the next slide here. So I'm going to, before we start, this is a pretty emotional video clip. So this is the video clip of a young woman in the city of Wuhan on Qingmingjie, on April 4th this year, coming out of her apartment for the first time in over 2 months, stepping out of her apartment for the first time in 8 weeks. And the city came to a halt. Well, the entire nation actually came to a halt at 10 o'clock on April 4th, and to observe a 3-minute silence to mourn the dead. So you see her kind of running to the main street of the city of Wuhan and crying and talking about.
现在是4月，要看看。现在是4月4号，2020年的4月4号上午10点钟，清明节。
So yes, at the end of the clip, this young woman says, "My city died, but came back to life, and it will stay alive." If we could go to the next slide, Bill. Okay. So following all these events in January and February, then March. Really, for me as an ethnographer, really brought back memories of my previous field research in the aftermath of the SARS outbreak in 2008. And so to see some of the same themes recurring now. Some of the issues that I mentioned in my previous work that are resurfacing now. One, of course, human-animal relations, as these are all SARS and COVID-19 These are all zoonotic diseases, meaning that they have animal origins, which always brings up issues of human-animal entanglements, as we see now, right, unfolding right in front of our eyes. And the second question that I looked at was consumption. So the one term became very popular during the SARS epidemic was the term the wet market. And we can just go to the slide, the next slide, Bill. And we can show both images. Yeah, the second one too. Yes. So see on the right-hand side of your screen is the image of a wet market, actually in Hong Kong. On this, and as you might have discussions of, you know, how the wet market related to the spread of zoonotic illnesses. And there was the same discussion back in 2003 about wet markets. Now, interestingly, the term wet market was first invented to talk about not China, but rather Chinatown in San Francisco. So it's a locally invented term. And it, you know, always carrying kind of stigma to talk how, you know, unclean the San Francisco Chinatown was, and only became popular in 2003 actually during the SARS outbreak, and it became a term that's widely circulated to about certain kinds of markets that sell, you know, live animals and other products. But you know, the term itself has a very fraught history. When I was still doing fieldwork, I think, on SARS, there were reports of animal rights activists going to San Francisco's Chinatown, sort of looking at, you know, all these dirty wet markets. In one instance, they accused a restaurant owner or shop owner of boiling a raccoon live in a pot. And the shop owner said, "Oh, of course, we will never do that because it wouldn't taste good," right? So that's the whole sort of discussion about the wet market that's again resurfaced in the context of the new coronavirus outbreak. You know, there are also that we medical biologists call the social body or embodiment. So you're seeing sort of images and representation of the coronavirus now in various kinds of you know, media outlets. What you see right now on the left-hand side of your screen is the front cover of the Economist in May 2003 at the height of the SARS outbreak, and you see on the cover the image of Chairman Mao, right, wearing the mask, sort of symbolizing the sick, you know, social body of China and the sort of the impending, you know, political doom, right? The title is, could it be become China's Chernobyl, which it didn't. And, you know, by the way, by that time, when you saw the image of Chairman Mao representing China on the front cover of Economist, he had been dead for almost 30 years. But there you go. So let's see. Let's go to the next slide. Doing field work, well, kind of following COVID-19 is very different from following SARS. So for starters, you know, the rise of social media really sort of compels us, right, to live it vicarious, well, in yeah, vicariously. So the main social media outlets in China right now are Weibo or microblog, which by around 3 years ago already had 340 million users taking Twitter. Weixin or WeChat had close to more than 1 billion users by the end of 2018. So the numbers are even bigger now. So social media is interesting because it's always overshadowed by something, well, first of all, there's the firewall, the Great Firewall of China. So it's not as easily, so it's kind of a divide between Chinese social media users and users of, say, Twitter, WhatsApp, Facebook, so on and so forth. So, the state does keep a pretty close eye on these social media, what people say on social, and sometimes, sensitive terms. People have to invent sort of very creative ways to talk about sensitive topics. So for example, Me Too movement was referred to as the rice bunny because rice is pronounced me and bunny is pronounced too, right, in Mandarin Chinese, right? So you kind of, you have to work around that. Sometimes really sensitive posts disappear after a few days. So, for me as a social scientist, it's kind of difficult to keep track because sometimes it's not there anymore. But it's not only the state, but there are also companies, venture and what's generally referred to in China today as capital, just capital 资本, that manipulate data on social media. You can buy certain trending terms. You can also suppress search terms that you don't want your social media users to see. So it's a constant struggle and these constant transactions that happen on Chinese social media. And thirdly, social media users also manipulate information and data themselves, right? So for example, fans of certain Chinese pop stars sort of manipulate what they want people to see about their idols, how to sort of bury all the negative information, extramarital affairs, and so on and so forth about their particular idol. So there are all sorts of ways in which sort of data or information is circulated, blocked, manipulated on Chinese social media. And let me just say that this is not unique, right, to Chinese social media. It happens elsewhere, obviously, as well. But this complicates our efforts in trying to understand what's going on. So a very popular phrase on Chinese social media these days, well, it's been popular for the last couple of years, is let the bullets fly for a while. So meaning that something, a big scandal gets exposed on social media, and instead of jumping to conclusion or jumping to action right away, sort of let it settle for a few days, for a few weeks. You're not necessarily going to get to the truth behind it, but you're going to get these layers and layers of very complex stories that don't always add up. And that's something that we all have to live with. Okay, next slide, Ben. So I'm going to talk about just very briefly about some of the things that we here, in California, in the United States, do not necessarily see in reports on the new coronavirus, novel coronavirus outbreak in China. So here's just a snapshot of what people in China are actually talking about, right? So there's actually a lot of discussions about the role of the state, what the government is supposed to do, or what the government is not supposed to do, right? And I can go into this during the Q&A if there are more questions, but I do want to talk about sort of discussions about healthcare reform in China. So this outbreak happened at a time when the healthcare system is being radically privatized in China. So the reaction from on social media is that, wow, you know, we're so lucky actually that the healthcare system hasn't been completely privatized. So the medical professionals who volunteered at the end of January, in February, and later on to go to Wuhan to help, you know, save people and fight the virus are predominantly from state-run public hospitals, and the state was actually able to, you know, mobilize all this human power to, you know, to stage this massive intervention. So what you're seeing, the picture on the lower right side is a what's called a hospital, or a mobile cabin hospital that they basically built in several of them outside of Wuhan. So the two most famous one was built on the Shan, the mountain of the thunder god, and the other one was built on Shan, which was the mountain of the fire god. So there were also kind of, you know, all these Chinese cosmological ideas about let's bring the gods in to, you know, help put this thing out. So as you can see, you know, these are all beds for patients to moving, and then medical professionals, nurses, and doctors staffing, you know, coming from other parts of China, helping to staff these makeshift hospitals. So, and let's see, and this also happened at a time when there is a lot of violence against medical professionals. So just a few days or a few weeks before the outbreak, there were two big scandals exploding on Chinese social media about two doctors being murdered by their patients. So this was really kind of a huge shock, right, to social media users who were forced to really reflect on you know, doctor-patient relations and what's going to happen what would have happened if the medical professionals hadn't been there. So next slide, please, Bill. And something that's really interesting is that about, the majority of the nurses and doctors who went to Wuhan were women. So some estimated about 80%, but you know, we don't have the data yet. But if you look at sort of you know, images and video clips of medical professionals fighting on the front line, a lot of them were women, and that's very unusual because official representations of, you know, sort of medical professionals or anybody who accomplishes anything is often dominated by male images. You can have a, you know, group of, let's say, 9 women, and one man would put each of the man right on the front cover. So this is really unusual to see so many images of women fighting on the front line. And it happened at a time, again, when there are a lot of discussions about gender roles, about women's places in China, and, you know, I can go into this too during Q&A, partly because of the shift from the one-child policy to two-child policy now, and, you know, sort of what sort of women being asked to go back home to, you know, have babies and children. So, so there actually has been sort of a backlash against the revision of gender roles in Chinese society. So it is an occasion where sort of women really show themselves as professionals, right, as caretakers, also as victims. You know, all these nurses and doctors had to wear protective gear, right, for the entire day. And you know, what about women who, when they menstruate, right? So, and there are all these sort of people are saying, well, are they not allowed to menstruate? Well, you have to take care of that, right? And then there also, I'm going to show you the next slide, actually, Bill. On the right-hand side, you see 4 women with shaved heads, right? So because they have to wear the protective gear, some of them shaved their hair off. And there were clips that were circulated on social media about, you know, sort of young women crying after their hair being, you know, forcefully shaved off. And you know, again, is this the right way to treat you know, female medical professionals? And then on the left-hand side of the screen, it just says this is one medical team that went to from one hospital in, I think in Beijing or Shanghai, and 88 out of 136 were women. And the one on the left-hand side, on her uniform, it says "Mother of Dodo." That's the name of her child. So a lot of these people were separated from their family for, you know, a prolonged period of time. And the woman on the right-hand side had the name of her favorite star on her. Her uniform says, "Wait for me," right? Till back, I'm going to come back to see you. So again, sort of discussions of these very, you know, complex also during the in China right now. Next. Okay. So and of course there are a lot of discussions now about, you know, what it means to be human, not in China but all in the world. So one, you know, human-animal relations, especially relations through consumption. So, you know, people in China actually were the first to talk about the wet market and the practice of consuming wild animals. So a lot of this really has to do with the rise of mass consumption and consumerism, and sort of the a global economy that is fueled by certain kinds of new desires and new practices of consumption. Wet markets have always, or, you know, live animal markets have existed for a very long time now. What's different, you know, in the last 10, 20 years is actually the scale at which you know, consumption really takes place. You know, the people joke among themselves too about sort of eating certain species to extinction, and understanding actually that these are serious issues that are, you know, now right in front of in our face, so to speak. And there are actually also a lot of discussions about, you know, sort of everybody being quarantined inside of their apartments, in their homes, and wildlife actually started to come back, not only in China, but in other parts of the world as well. You might have seen images of, you know, schools of fish reappearing in Venice. River dolphins were spotted for the first time in who knows how long in the rivers of outside of Wuhan, for examples, and just starting to realize, you know, oh, like how much the human beings, we've really encroached on, you know, wildlife, right? The space that other creatures would have occupied. If we just stayed home, you know, for, you know, 2 months, right? What a change that has already made. And what does it mean to be human, right? When your right to live is no longer taken for granted. Right? So as I mentioned earlier during the Qingming Festival, the state wanted people to commemorate those who perished in Wuhan, to commemorate healthcare professionals who died on the front line. But social media users also composed their own lists of people who perished while crying for help, right? Whistleblowers who, you know, then continued to fight on the front line and died because due to the infection, right? So they also composed their own list of people who were forgotten or buried in the official narrative or in mass media presentation of the casualty of the outbreak of the pandemic. And also a lot of these people are, you know, marginalized, you know, elderly folks, right, homeless folks, janitors, right, who had to pick up trash to keep the city going, right? So there are a lot of discussions about how to, you know, deal with those lives, right, with respect and not letting them be forgotten in the midst of the pandemic. So I think we can open up for question, Bill, and we can show the clip. This is, as of, so on the, you know, this is all pretty heavy stuff. So this is a happier clip that people put together. These are this is a compilation of video clips of medical professionals as they were fighting on the front line. So as of yesterday, I think the last mobile cabin hospital closed in China. So there, we don't have to show the whole thing, it's pretty long, but yeah.
180杯，这酒怎么样？听我给你吹。
Okay, so yeah, so.
I was tempted to let it run, and then I felt like I kind of wanted to start synchronized dancing too. But,
yes, that's some human spirit there.
That is some spirit indeed. May, thank you so much. We have several questions here from the folks who are attending this session, and I'll just start by grouping a couple that kind of go together. So there's one from Arlene and one from Luke, both asking questions about the gender, the gender stuff you talked about and the large number of female physicians. And the question is, is it that the majority of healthcare workers in Wuhan or who were sent to Wuhan were women? And also related to it, was there a sense on the part of those sending them that, well, women are more expendable, so let's send the women?
Oh, great questions. So I think the gender ratio of medical professionals actually is pretty even. So things, one is there are actually more nurses than doctors who went to Wuhan. So the day-to-day operation, a lot of that was actually done by nurses. And if you look at the doctors ratio, there are definitely more women working as nurses than as doctors. I'm not sure why more women volunteered than men. My guess would be, this is still unfolding, so I haven't really done any kind of follow-up research, but this is something I myself want to know more. So, I think at this point, my guess is because more nurses than doctors either went to Wuhan or sort of engaged in sort of the everyday care of the patients. There, sort of a lot of video clips showing nurses or nurse practitioners, operating sort of oxygen tanks and ventilators and so on and so forth. So they are the ones who really are putting in the labor in Wuhan at this point. And also, their dilemma in a lot of ways is much deeper than the dilemma of their male counterparts, right? I mean, there's the real, there's the human, these are mostly young women, right? So, yes, we bleed every month. So what do you do, about that, right? That must be taken into consideration. And there's also this kind of long-standing practice now of, not only in China, but elsewhere in our global economy too, constructing certain ideas of women as consumers, right? You're supposed to, in a video clip that I didn't have the time to show today, one nurse was interviewed and asked, so what are you going to do, right? After this is all over, I want to go shopping, right? I want to, I want to buy cosmetics, I want to buy, pretty, and here's the designer brand that I want, right? I think it was Saint Laurent or something, right? So again, sort of this is more of a jolt, I think, to the public, because this is so different from the gender roles that people saw in the last years.
So there's a question here also from Jacob, who asks about social media trends changing following the news that Dr. Li Wenliang, following that news, and has there been increased anger directed to the government? How has the government handled this? And maybe say a little bit about the doctor too. So
the doctor was one of the 8 whistleblowers that he was a ophthalmologist. So I think he was just basically doing his job, reporting it as it was. And I actually have a list here. Let's see, a list of Maurer compiled by one of the social media users that talked about Li Wenliang. And it says right here, and that was posted on April 4th on Qingmingjie. Let's not forget Li Wenliang. Regardless how his identity is defined by people, by the official media and by grassroots social media, coming from different perspectives with different positions. Let's remember him as a good person. He's just like us. He was just like us, living a very ordinary life. And one of those people who had the greatest in them brought out because of the epidemic. So I think a lot of people identified with him because he was really, he had of course had a social media account like everybody else, and he loves, fried chicken. He, also followed a star. I don't know, like everybody's following the pop star. So he was somebody that everybody could relate to. He was young, right? So it was really sort of a sense of he was really like one of us, and they wanted him to be. So, he was reprimanded by, I think, the police or whichever level of the government at the very beginning, because they thought you should never spread rumors that would destabilize society. And so the Chinese state, it's interesting. They're never going to come out and say, "Oh, sorry, we're really sorry, we did this wrong." But they just made him a martyr on, I think, April 4th. So, paid him respect and recognition, and that was enough. And it was understood, right? That was the state's way of saying, "Oh, oops, we were really wrong," right? But there was also a lot of anger. It's only the lower level officials that got punished, right? But it's unclear at this point because this is the pandemic is far from over, so it's unclear at this point what additional measures or shakeups that would take place later on. So they did do a lot of blame. They fired a bunch of people in, I think, February. So I think the governor of Hubei province was fired very shortly after the city was quarantined, and then they basically parachuted the mayor of Shanghai into Hubei province. That's where the city of Wuhan is. So people in Hubei were super happy. We got the mayor of Shanghai, until found out that in Shanghai we're also very was asked to leave, and then they were just like, "Oh, maybe it's as good as we thought it would be." And also I think again, sort of going back to all these Chinese customs. So you pay. So the dead is not the soul of the dead doesn't really leave until a 49-day period, and you're supposed to stage a ritual to commemorate 7 days. So on the 7th day of the death of Dr. Li Wenliang, people in Wuhan staged a ceremony where they, at 9 o'clock, I think, in the evening, everybody came out and blew whistles. And it was seen all across social media. Yeah.
There's another social media question here too, from Li Zhang, and it asks, could you speak to the vibrant online debates about Fang Fang's Wuhan diary, and do you want me to keep going, and whether to blame or congratulate China about how the epidemic has been managed?
I have to say I haven't followed Fang Fang's diary. It was just too much. There's just too much stuff going on. I couldn't follow all the leads. So my interest really came out of my own project too, which is really on the doctors and nurses. Yeah.
Well, just so that you know, for future research, there's even another question about Fang Fang's diary from Zhan. So just so you know.
Oh, okay.
Inquiring minds want to know. So maybe you can
Yeah, I know, because the people that I talked to on social media were telling me like, "Oh, have you seen this diary?" Right. So I just haven't really just basically just ran out of time, just haven't had the time to really go into it.
Okay. Well, let me, there's a couple more here about the state and state authority and about the social standing and social position of doctors. So Cheiko asks, do you think the epidemic is strengthening state power and authority, or is it undermining people's confidence? And then there's a similar kind of question from Amin, and then also from Jade, which is about people's perception toward healthcare workers. So like in terms of like, people trusting or distrusting more the state, or people respecting or disrespecting more healthcare workers, what do you see going on in these social media discussions?
Let me talk about healthcare workers first. So I don't want to say I'm cynical, but so the same thing happened during the SARS epidemic in 2003. It was also a time of heightened, tension between medical professionals, healthcare workers on one hand, and patients and consumers on the other hand. And what's happened, right? And then all these, doctors and nurses went to the front line and, died, some of them, as a result. And there was kind of a, we think again about the role of care professionals. They're not just, people who are in this profession because it's lucrative. But then they kind of reverted back to, again, sort of this troubled relationship between healthcare workers and the general public. So, of course, they are, all spoken of as heroes, right? But it's unclear to me what's going to happen once all this is over. But right now, there's a huge push actually on social media to make sure that these healthcare professionals are at least properly paid for their labor, right? Because some of them aren't, especially the ones that are visible, right, in front of the public. The state, that's really interesting. And this is still ongoing, so there's really no conclusion at this point. So what I can see now, and this is something that anthropologists of China have been kind of studying for a while now, is the sort of the Chinese state reinventing itself, using old ideas, well, not old ideas, using sort of certain ideas of fusionism, right? So the sort of, in other words, the state as a sort of a patriarchal presence, right? So in this case, I think they wanted to show that they were there to take care of in domestic China will be the subjects, right? So in China, so we're there to take care of the citizens. So that's the way. So there's that kind of image that's being kind of pushed to the front. There's also, let's see, the sort of a discussion. There's been discussions about sort of different kinds of state officials, right? So there are a lot of criticisms of people who kind of put the advancement of their own political careers ahead of everything else. So the one thing that people talk about on social media is that the news from Wuhan didn't come out right away because I think it was either the mayor or the party secretary wanted to have this event and didn't disrupt it, right? So sort of kept it under the cover for longer than he should have. And then there are also kind of praises of technocrats, people who are more pragmatic, officials who are more pragmatic in their approach to the you kind of really see different kinds or different faces of the state coming out during the pandemic. And they're also, like here too, the provincial officials sort of like they fight against each other. They over, resources, intercepting, another cities or provinces maps, right? So it's all a little bit right now. So wait till it all settles a little. At least, these are epidemics. They always, as a medical anthropologist, there's a long history of kind of existing controversies and issues being sharpened, right? Sort of come to the fore during times of crises, and especially these large-scale epidemics and pandemics. And that's what we're seeing now too in China.
Yeah, well, thank you so much, Professor Zhan. And I apologize to those whose questions we didn't have time to get to, but thank you also to our attendees for contributing these terrific questions and really sticking with us to engage in this weird Zoom way that we're able to do things. I can't help but think about your answers to those last questions about healthcare professionals in the state. I can't help but think about the parallels that we're seeing here in this country and the similar kinds of questions that are coming up. We may all go out and cheer at 8 p.m., for our healthcare professionals, but let's see what happens, when this crisis hopefully is behind us. Will we remember them, and will we do what's right by them? Again, Professor Zhan, thank you so much. I also want to thank Andy Hill from the School of Social Sciences Office of Computing Services for assisting in setting this up. And again, I want to thank all of you for coming here this afternoon. It's really, really been a pleasure. Have a great day. Stay safe.
Thank you all. Be well.
Please continue social distancing. Yep.
Yes.